The COVID Delta variant falling through the cracks in Fujian Province with dozens infected. What does this latest clusters of cases in Fujian Province tell us? We'll get some answers after the break. Welcome back. This is World Insight. I'm Tian Wei. The Chinese mainland lost no time in dealing with a COVID Delta variant outbreak in southeastern province of Fujian. Mass testing in Putian yielded increasing cases in the past few days. Authorities said the source may have been a person who recently returned to Fujian from Southeast Asia. In-person classes in all kindergartens, primary schools, and secondary schools and tutoring institutions have all been suspended there. The central government has dispatched a working group to guide the local prevention and control work. With the Mid-Autumn Festival and October National Day holiday just around the corner, new cases add pressure to pandemic control in China. What does the latest outbreak teach us? There are many questions to be answered. Let's bring in our panelists. For more on the latest COVID variant and Fujian cluster in Nanjing, Wu Zhiwei, director from the Center for Public Health Research with the Nanjing University of Medical School. And meanwhile, in New Haven, Xi Chen, Associate Professor of Health Policy and Economics from Yale School of Public Health. Gentlemen, welcome to the program. So tell me, Professor Wu, how are these cases being discovered? And is it the same practice elsewhere in the rest of the country?
Well, it's not totally random. It's actually the testing is carried on in more kind of focused or targeted populations, particularly for people who are actually traveling abroad and came back to China. And this is the population when they are in quarantine. They actually usually go undergo very extensive testing. Every few days they will take a test. Mm-hmm. But for general population, very much based on the contact and so-called contact tracing, and also sub-contact tracing as well. So this is pretty much done very well structured testing. So in the large population, what we have done is that we pull the 10 people. The sample from 10 people and then do a test. If one positive sample is identified, then basically we will go to the individual and to take further tests. Mm-hmm. So this is pretty much we have been doing all over the country so far. I mean, so far this has been a very effective approach in identifying the infected cases and also the contacts as well. So, but it's very labor intensive and cost intensives as well.
Professor Chen Shi, being someone closely watching the latest situations in China, what do you make of what's going on right now?
I think at least the three conditions has to be met in order to be approaching this virus as a common flu. The first is most important is high vaccination rate. Mm-hmm. So to approach herd immunity. But from the epidemiology calculations, if we make the standard assumption, it will be higher than 80%. But in China, currently like 60% of people, about 900 million people are fully vaccinated. By the end of this year, China would achieve 80%. But if with the Delta variant, this 80% may not be high enough to achieve the herd immunity.
Do we know
probably
what percent?
90%.
Okay.
I think the second and third condition also need to be met. The second is the capacity to launch strict public health controls. We need to maintain this capacity to have large-scale, rigorous testing, quarantine, and contact tracing. And also the third condition have to be met is the capacity for the therapeutic treatment, which means that health sector has to be prepared. We cannot crush the healthcare system because there are so many other diseases need to be treated.
I fully agree with Professor Chen's point. We can actually increase the vaccination rates, not only 80%. I would say that if possible, if resources allow, now we would try to vaccinate 100% of people. Yeah. The other thing is that, as Professor Chen mentioned, that we need to have a therapeutic approach. If we reach that kind of status, then we would be turning this COVID-19 into just a regular flu.
Right. Of course, from now until 90% and even more than that vaccination rate, we're still a bit far from there. And as we get ever closer to that number, more challenges and more difficulties it would be. Professor Wu, China, of course, now is still practice its very unique zero tolerance system. And this has been working extremely well over the past, arguably, 1 year and a half. So how much do you see that is still having its potential? At the same time, how much do you see the challenges that it might face in the near future?
Well, let's go back to about a year ago when we had a so-called zero tolerance policy. We had an assumption that if we fully stop the virus, if we control the infection and bring down the infection to zero for a certain period, then we would be able to stop the pandemic. So that was very much the rationale for taking zero tolerance. But what we learned in the past is that it's almost impossible to achieve. That the virus is so adaptable and so easily mutating and penetrate the human immunity shell. That's the real problem we are facing. And we can see from Nanjing's cases, from Fujian's cases, which actually tells us that maybe we will never be able to control the virus completely. So the virus would become something like a common flu. So this is something we have to bear in mind. The current policy basically suffers a tremendous burden in terms of cost, in terms of disruption to the social life, and also the disruption of the interaction, the entire social fabric. I think this is something we have to bear in mind, and public health policy actually has to consider the cost and the benefit issues.
If not this system, what is the alternative? Nobody's having the perfect solution and answer, but the debate and discussion as time goes by, as circumstances change, about what is the best practice for now, may be a very crucial topic. Please shed some light on this.
We have to expedite the vaccination rates and quickly reach a very high level of vaccination rates, such as 90 or even 100%. And then we should expedite the drug development, such as therapeutic antibodies and the chemical drugs, like just we used for common flu. The other thing is that for screening and testing, we probably need to structure this entire public health approach by focusing on certain populations, so-called the highly susceptible population. You could increase the testing frequency and also develop a tracing mechanism. Then once a positive case is identified, we can quickly actually identify those close contacts and then basically develop a certain quarantine or observatory system to minimize the disruption to the entire society. I think the current approach, once we identify a couple of cases and we shut down the whole system and stop all the public activities, it's just not viable in the long term. It's too much disruption to the economic and the social activities.
Although we have all such kind of worrisome news, but there's encouraging news. If you look at the data over the last 1 year and a half and more than that, the case fatality rate has been declining, especially after the vaccination campaign worldwide. So if we look at before the vaccination, the case fatality rate was around like 2 or more than 2, depending on the healthcare system in each country, which would be like 20 times more than the death rate for the seasonal flu. But after the vaccination campaign, especially in the last 3 months, the world has been scaled up the vaccination campaign. The case fatality rate has been reducing to like 0.2, 0.3, in some countries 1 point something, but it's dramatically reducing. So this is encouraging. So that means with more and more people are getting vaccinated, we are more and more approaching treating this as a seasonal flu. I think for China, they are, unlike many other countries, are fighting two fronts: the domestic transmissions and the imported transmissions. China's threat is more from the imported ones. So it's more important to target those more important locations like the transportation hub and the schools and the service sector, and especially linked to the imported cases. And there are some tools at our disposal. For example, we're talking about the testing, the PCR test, but besides that, some other countries have some good lessons to share with China. For example, the antigen test, which is a little bit cheaper and can get the results very soon. Unlike the PCR test, it can return the result in like 15 minutes.
How do you see that different practices learn from one another? Is it possible?
China has been tremendously successful in controlling the pandemic in China, but I doubt this system is easily adopted by other countries because the Chinese government actually has a strong political will in terms of controlling this pandemic. And the people are actually generally highly cooperating with the government policy. So I think this is the key to make this policy successful. Because all the public health policies, particularly the quarantine and also other interventionary policies introduced, very much has a lot to do with individual countries' culture, political system,
right.
Jurisdictions. So it's a very hard thing for other countries to adopt. The other thing is that for many other countries, like in the Western hemisphere, they're highly dependent on tax income. So you have to generate tax revenue to support whatever programs you introduce. And we have seen that in Europe and in America, what we see is that sometimes when you have a certain kind of social distance and policy introduced, right. After a very short period, they have to lessen it and the people come out again. And then the virus will bounce back, and then you adopt another round of control, then the virus goes down.
Exactly.
And so basically what we saw is up and down. So this is something actually we are facing. It's the reality in the world.
For example, Norway, Singapore, New Zealand, all those countries are trying to shift away from the zero tolerance but to the so-called living with COVID. So those are countries at different stage of the virus surge and different stage of like healthcare preparation, their public health system, and also the vaccination rate. And some countries are doing better than the others. China could learn from them. And at the same time, China should be like having a short-term goal and a long-term objective. The short term is trying to achieve as better as possible the preparation at the vaccination campaign, public health sector and the healthcare sector. And at the same time, have a blueprint about the long-term strategy against this COVID. China will watch and say how other countries deal with and at what point and with what kind of preparations, the facilities, capacities, the country can achieve some successful so-called living with the COVID and without going back to the lockdown, without going back to a large number of casualties and infections at the basis.
So far, I think we have not provided any specific solution, but have been shedding quite some light on the best practices and possible solutions we could at least search for. Thank you so much, Professor Wu and Professor Chen, for helping us with your expertise. Really appreciate it. And that's all the time we have for today. If you'd like to see more Search World Insight, check out our YouTube channel, follow us on Twitter and Facebook. I'm Tian Wei on behalf of the team. Thanks for watching.